Hi there, my name is Heather Albright. I'm a registered nurse attending the Lamar University Baccalaureate of Science program. This is a capstone and 5-year plan presentation for the Synthesis of Professional Nursing course. Throughout this presentation, I will explain how I have met the 7 student learning outcomes required for successful completion of the program to obtain a Baccalaureate of Science in Nursing degree. First, I'll give you a little background information on myself. I graduated from San Jacinto College with an associate's degree in nursing and became a registered nurse after successful completion of the NCLEX RN exam. I am currently attending Lamar University's baccalaureate program and will graduate in December of 2018. I began my nursing career in cardiac intermediate care and have more than 10 years of experience caring for patients with compromised cardiovascular systems. I have enjoyed 8 years as a recovery nurse in the specialty areas of cardiac cath lab and interventional radiology. I am certified in both basic and advanced cardiac life support. The first learning outcome I will discuss falls under the humanity and society construct. It requires the student to practice safe and effective, holistic, patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. The Windshield Survey assignment in the Care of Communities course helped me to meet this goal by expanding my view of patient care from an individual patient to multiple patients in the community. Further learning was achieved through the Hurricane Disaster Teaching Plan and video for an at-risk population. Evidence and nursing theory was utilized to develop this disaster teaching plan for patients with end-stage renal disease. The Care of Communities course also prepared students for meeting this outcome from a global perspective through the Global Health online discussion in which my group discussed the global issue of unsafe water. In addition, the Civic Pride and Diversity presentation helped me to meet this goal by discovering a volunteer program, Project Cure, which is involved in providing unused medical supplies to underserved communities around the world. This learning outcome was met by 97%. The lifespan and health continuum construct. Outcome number 2 requires the student to support patients or clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The comprehensive holistic health assessment course helped me to meet this outcome through the Healthy People 2020 assignment. I discussed the importance of Objective 22, which promotes increased use of cardiac rehab for patients post-coronary intervention to help them restore and achieve better health. This outcome was met by 97%. Outcome number 3 requires the learner to evaluate patient-centered care for patients or clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. The comprehensive holistic health assessment course through the Shadow Health assignments helped me meet this outcome by providing simulated assessment practice, focused exam discussions, and simulated comprehensive health assessment. The Compromised Multiple Health States course also helped me meet this outcome through practicum reflection assignments and online discussions about compromised health states. This outcome was met by 96%. Outcome number 4, under the evidence-based practice and clinical reasoning construct, requires the student to synthesize clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. The Nursing Theory Evidence-Based Practice course taught this goal with assignments for the student to complete literature review and research article critique, along with discussions about ethical issues in research. These activities taught me the importance of utilizing evidence-based practice and how to think critically about the research process, specifically to consider where information is coming from and how it is obtained. This outcome was met by 93%. Outcome number 5 teaches the student to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients or clients and members of the interprofessional and intraprofessional healthcare team. This outcome was met through the Nursing Theory and online education course. The nursing philosophy paper involved exploration and study of nursing theories in which the student will use in their practice to provide patient-centered care. The Differentiated Essential Competencies paper required the student to apply these competencies to a patient fall scenario. This outcome was met by 96%. Outcome number 6 falls under the professional roles construct and asks the student to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional and intraprofessional healthcare team. The Leadership and Management in Healthcare System class helped students meet this goal through the clinical application paper in which the student used evidence-based practice and research to revise a policy or procedure in the workplace. This outcome was met by 95%. Outcome number 7 also applies to the professional roles construct, requiring the student to demonstrate professional integrity, effective communication, active inquiry, and service to the community. This outcome was met through the Leadership and Management class with the assignment of the Qualities of Effective Leadership paper. This outcome was met by 100%. As you can see, the 7 learning outcomes required for completion of the baccalaureate program have been successfully met. My first goal in my 5-year plan to obtain a Bachelor's of Science degree in nursing will be achieved in December of 2018. Within the next year, I plan to obtain an Advanced Cardiac Vascular Nursing certification to earn the RN Board Certified credential from the American Nurses Credentialing Center. Within the next 3 years, I plan to obtain the Cardiac Medicine certification from the American Association of Critical Care Nurses. At the 5-year mark, I will enroll in a master's degree program for education with plans to advance to a clinical educator role. I'd like to thank you, the faculty and fellow students, for their support in meeting these learning outcomes, and I wish everyone good luck. Thank you.